All right. I want to thank you guys for joining me again today. I'm really excited to have Tab here. She is back for part two of her insight that she's sharing with us regarding our own healthcare advocacy. So many of us, even during this time, we have family members who are struggling with health issues during the coronavirus and different things that may be happening. So it's important to kind of figure out how can we be our own advocate? What kind of questions should we be asking our healthcare providers? And what are some of our rights and things that we just kind of take for granted and are not sure of? So we're really excited to have her back and share her insight. So at this time, before we get into some of these strategies, we're going to give Tab the opportunity to kind of give us a little recap of what her experience has been and a little bit about herself.
Hi, everyone. My name is Tab Calvitti. I am an individual who's undergone 4 major back surgeries and then a complete reconstructive back surgery. I have a lot of experience with what's going on currently in the medical field, how that affects us patients, and had to learn along the way how to really advocate for myself in order to get that reconstructive surgery. And it was a lot of work. And I realized along the way how much people don't know about how to advocate for themselves. So when we talked last week, I kind of gave an overview about what's going on in the medical field a little bit. And that's even before coronavirus, but this is just a standard of care that's kind of shifting and changing. And as we lean more into a managed care environment and these medical facilities are corporatizing, that bottom line for us as a patient changes dramatically. So advocating for ourselves becomes even more important. And while my story itself is interesting or intriguing to people, I think it's very much more important that I show people the steps for how to advocate for themselves and how to do it without a lot of stress or feeling overwhelmed. I won't lie to you and tell you that there's not a lot of follow up with it. There is a lot of follow up with it, and you're the only one that can be on top of your care. But I do have some tips that you can use to make that process easier and make that path for you as you're going towards your wellness um, much easier to transition through, much easier to get help from doctors from and for. So I'm going to go right into those those steps that I did. So one of the first things that a lot of people don't know is at every doctor's visit, you are required by law to receive a patient summary. And that patient summary gives you an overview of what your visit was with your doctor. I can't tell you how many doctors don't do this on a day-to-day basis. You're done with your appointment, you leave, you don't have that patient summary. And you
Mhm.
should have that patient summary. You should ask for that patient summary. And if they give you the excuse and say, well, the doctor needs to finish writing it up, make sure you get it the next day. Follow up for that.
Mhm.
That patient summary gives you an overview of what the doctor's writing about your care and the medicines that you're taking and your condition. And there's information on there that maybe the doctor really didn't talk to you about. And that's going to lead you to open up more dialogue and ask more questions about it. In addition to that, sometimes that medical form will have inaccuracies, and you're going to want to have those inaccuracies corrected. So if they show any type of inaccuracy, you want to get that inaccuracy directed to that doctor right away within that first 24 hours, 48 hours of your visit. You want to have something back to them in writing. Don't just call them and say, hey, my medical record is incorrect, and then expect them to fix and follow through with that. The staff, they don't even want to be bothered with it. Let me tell you this right now. You're going to have to put it in writing, list out where the inaccuracies are and what is the correct information, and ask them to change that and ask for a copy of the corrected medical file. They're required to do
Mhm.
this by law.
Mhm.
but they don't always do that. If they
Mhm.
disagree with you about the information on your file, you can request that your letter be permanently attached to your file that shows that you
Oh.
disputed it and it's not correct and that they wouldn't change it.
Hmm.
And a
Now,
lot of
what are
people,
some things that people don't change? Like if you say this is incorrect, what are some of those things that, would be fall into that category?
okay, so I'm gonna give an example, and it's a very realistic example. A doctor walks into the office. He's got a laptop. Many of them come in with laptops now, or a
Mhm.
tablet. And believe it or not, your information is kind of pre-filled from the previous patient. Well, what if that previous patient's information didn't clear? You now have information from that client to yourself.
Mhm.
And unless you get that that summary, you don't know that. And
Mhm.
that information, I'll give an example. You have that information, it's incorrect, you never correct it, you don't even know that it's there. And one day you're going for
Right.
a life insurance policy and they come back and they tell you you're denied because you have XYZ. And you're like, what do you mean? I don't have XYZ.
Right.
Well, guess what? It's on your in the medical bureau file.
Oh, that's
And
good. And I
so
was thinking too,
go ahead.
even like your vitals, if your weight is wrong, that affects the dosage for your medication and things like
It
that.
does. It does. So
Mhm.
there's a lot of
Mhm.
points in that patient summary which you should pay attention to and not ignore. If it's incorrect, you should have it corrected. Your your meds should always be corrected.
Mhm.
There's a lot that goes into that. You could be taking one medication with one doctor if it's not listed for another doctor, and they prescribe you something and it's it's a
Mhm.
contraindicating drug. You now have a
Mhm.
problem.
Mhm.
So your medical records, it's important that they're correct, but it's more important that you ask for that patient summary when you're leaving every visit and that information is correct. And if it's not, you follow up with it right away to get that
Mhm.
information corrected.
Mhm.
One of the other things that I say to people is that you should periodically ask for your medical file. If you have a major health condition, you should be asking for your medical file every 6 months at a minimum, especially if you're somebody that goes to the doctors a lot. You are constantly going to want your updated information. If you've got a lot of routine care, once a year is fine. But you're going to want to stay on top of having copies of all your labs, copies of all your major tests. The labs, a lot of the lab companies will give you the copies of your lab tests now. You can log online and get them.
Mhm.
They've started doing that. If you do any radiologic work, you can get a copy of those directly from the facility. They'll give those to you. They'll give it to you right at the time that you do it. They'll
Awesome.
give you a copy of the CD. They'll make you wait 24 hours, and then you're allowed to pick up a copy of your actual report. So they wait that 24 hours so that the doctor has it first, and then you can get a copy. Even if you have a facility that's a little funny and they make you wait 2 days or a week, you're still entitled to it. Make sure you get it. Keep your own file of it. Okay. If anything is incorrect in those, you make sure you challenge it the same way. You put it in writing, you state what is incorrect, and you ask them to correct it, and you go through the same process again. But what's really important about keeping your medical file, especially if you have a lot of health issues or you have something where you need to see a lot of doctors or you want to get more opinions, every cell phone has Adobe Acrobat. You can upload it, it's a free app. And it allows you to scan up to 25 pages at a time right with your phone. You take a picture of the document, you create a file, you could forward it to yourself, put it on a little zip drive. Everybody's got a little zip drive. Of course, I had one right here. Did I
Mhm.
have you? Everybody's got a nice little USB.
Mhm.
Upload
Mhm.
it to it. Keep this in your pocketbook. Everywhere you go, if a doctor has a question, you now say, you can whip this out, have them download it, and say, here's all of my medical information right at your
Love that.
fingertips. It
I love that.
works phenomenally. And
Mhm.
doctors love it because all of a sudden they could see all your labs, they could see all of your imaging, they know all of your reports. The only thing that you actually physically have to bring with you may be that stack of CDs that you have.
Mhm.
But your medical information is all there. And when you're going for consultations, especially if you have a major medical issue or you're looking at going for surgery, no one has to question everything. You've brought everything to them. It's all correct. You can sit there,
Mhm.
you can have your conversation with them and move forward. So anybody who doesn't feel that they can get all of that information, you really can, and it's all there for you. It's part of what our HIPAA laws are about, and it puts
Mhm.
this information at your fingertip. Now, some medical practices, I'll be openly honest with you, don't like when you start asking for all of that information and you want to take control. There will always be, there's always that one person in every medical facility that wants overt control over everything, and
Mhm.
wants you to just completely trust in them and everything that they do with regard to your care. And they'll resist. They won't like it. And you know what? Tough
Mhm.
luck. It's your
Mhm.
body, your rights, and
Mhm.
your medical information. So do what's right for you and don't care about the one person in the medical practice that doesn't like you asking for this
Right.
information.
And do you feel like when you are more aware of what your history is, your conversation changes with your healthcare provider in terms of
Dramatically.
yeah. Mhm.
Dramatically. I think what happens when you ask for that information, doctors become very, very aware that you're that patient that's going to be really, really on top of your care. And it
Mhm.
allows a doctor to kind of step more into their game.
Mhm.
Okay.
Mhm.
I'm sure that there's that connotation, there's that patient, they're just looking to, um, create a problem or
Mhm.
maybe sue down the road. And it's not what I'm advocating. I'm advocating your rights, and you have these rights. And it kind of puts your care out of that managed care and
Mhm.
into a direct care. And that's where it should be. And
Mhm.
I think it also puts a doctor in a position where instead of that managed care where he just kind of skates you on out, all
Mhm.
of a sudden he's thinking a lot more about your care. And I think that that's a huge difference in our care. And I don't think that we should be facing that as patients. I think that we all are entitled to that top notch care, but we don't
Mhm.
always get that. So these are little tips to kind of help you get that better care from your physician. Um, Another thing that I say for people is don't be afraid to ask your doctor to get something in writing.
Mhm.
Especially you have a major medical issue, you're going for surgery, want it
Mhm.
in writing.
Mhm.
Ask. And
Mhm.
and then they might not like it and they might be uncomfortable with it, but it is your right to ask.
Yeah.
Doesn't make you a bad person for doing that.
Mhm.
So, you shouldn't be afraid to ask
Mhm.
for your information. You shouldn't be afraid to ask for something in writing. You shouldn't be afraid to ask the questions about your care that you should be getting. And I think what really doing all of this with tracking your care and having this information at your fingertips gives you a much better stance of having more open dialogue and conversation with your physicians.
Mhm.
Oh,
That's good. That's good. And I think another thing is just the whole point that people feel really intimidated, when it comes to the medical industry. I was listening to somebody one time on a podcast and they said, we just throw our control away when we find that we're in an area that we're not familiar with. So, you take medicine, you have symptoms and it's like, oh, I don't know what's wrong with me. And then you just lay down and let the person tell you whatever. Same thing with plumbing or any other field that you may not be well versed in. But I like the element of taking those notes and getting it documented because even if you want to get a second or third opinion, you can go to another doctor and then you're like, well, this is what they told me. Then they start asking you questions and you're like, well, I don't know. I didn't ask that or whatever. So I think that's good.
and I think we've entered a stage too where don't be afraid to ask your doctor if you could record your meeting
Mhm.
and do an audio recording of it. It's not that you're looking to use something against them, but what if you're forgetting something later? Especially if you're
Mhm.
going for a major surgery, you're going for another procedure, you're not going to remember all of those questions. You may want that to revert back to later.
Yeah.
And you'll find that most doctors are pretty amenable to that.
Mhm.
You'll have ones that won't be, but most will be.
Mhm.
So start asking for it. We have all of this technology now use it.
Yeah.
You know, let's see. I knew I one other thing, I didn't want to lose it as we go. Oh, here's another thing. If you are, conversing back and forth with a medical facility, and you're speaking with a lot of different staff, and you're trying to get things coordinated, or um, get something done with your care, a tip that I learned, especially when you have a major medical issue, or you're undergoing multiple surgeries, or a major surgery, you have something going on medically that requires a lot of care, start following up with those conversations in writing. So if you have a conversation with a staff member about something that they're supposed to do a quick email, put it in your my chart, whatever document that they're using to go back and forth, but create that paper trail. Do a
Mm-hmm.
quick follow-up summary. I spoke with you. This is just a quick follow, quick summary of our conversation. You know, thank you. I'll be waiting for whatever information you'll be getting from me, but document it, because those
Mm-hmm.
phone calls, they, as one doctor put it to me, you are one person among hundreds that they see every single day. It's so easy for your stuff to get put to the side, and that follow up is not always there. It's not the fault of anybody. It just happens to be how our healthcare system is. So it becomes up to you to do all of your follow up care. So I think that's
Mm-hmm.
really important. Utilize all of those things at your fingertips. Is it a pain in the neck? It most certainly is. If you're really, really sick, ask somebody who's close to you that's really good and detailed at stuff like that to help you with those items, because that
Mm-hmm.
becomes super, super important in your care.
Mm-hmm.
Um,
That's a great point because, in your case, you were managing having a totally different positive outlook based on what the doctors were prescribing was going to be your outcome. You know, they're telling you that you may not walk and all this. And so that's a lot on itself. And then to have to manage your own records and, communication, who you spoke to when. I mean, that's really a lot.
it was a lot, and
Mm-hmm.
it was a huge learning experience too, about how quickly you could get brushed to the side because there wasn't belief in what you were capable of doing. And I mean, that's a whole nother conversation about how doctors personal opinions differ from their professional opinions, and that they can completely write you off as a patient,
Mm-hmm.
without giving you a chance to overcome anything that you may be going through. And I personally have a bit of a problem with that. I don't think that anybody should be um, giving anybody um, reason not to believe or to hope. It's one thing to say, listen, these are the facts. These are, a lot of case scenarios for that type of thing. But I don't think that it's anybody's right to tell you that you can't make a recovery, or you can't do something better. We see it every single day. Um, but that's not necessarily what goes on. And I think that shifts quite a bit when you start advocating for yourself, and
Mm-hmm.
you're following up with all of your records, because the question that you get to ask a doctor again and again and again is this: are you comfortable with taking my case or handling my case? Are you comfortable with moving forward to the outcome that I want? Or do you feel that your skill level is not there and I need to see somebody else? And that's a really important question that you have to ask in your care, because it's okay for a doctor not to have that skill level. It's okay for them not even to have that comfort level. I once had a surgeon tell me that he knew that I needed surgery, except that he was not capable of performing that surgery. He flat out admitted it. Not everybody will do that,
Mm-hmm.
but you have to give them that option, that out, to say, are you not skilled, or are you just not comfortable with it? Do I need somebody else? Is my care more involved than you are capable of giving me at this time? And allow them to answer that. And it's a different conversation when you start to have that with a doctor, because it's not adversarial. You're not accusing
Mm-hmm.
them of anything. You're just openly asking them, hey, are you the right doctor for me? Because they don't often tell you that you're not the right patient for them.
Mm-hmm.
That rarely happens. So you
Mm-hmm.
have to ask that question to find out if you are. and then know whether or not you need to keep looking at another facility or another hospital or another doctor, get another opinion.
Mhm. That is a good point because I'm telling you that is not a normal question that you would ask a doctor. It's like they have the white coat on, they've got their certificate on the wall. You just don't even think to ask them some of these questions, which I think is really eye opening for a lot of us as, just citizens and people who have situations. One, when you have something happen to you that you're unfamiliar with, you're just in this loss of not knowing what to do. And it's like you just see them as the end all be all, that they have all the answers. And, you really don't even think to question it. A lot of us are even afraid to even go to the doctor. So when we get there, we really are like, okay, I'm really not going to question them, because it's like you don't want to hear anything else negative.
But I think maybe you got to look at it as not hearing something as negative as much
Hmm.
as, perspective is everything. Maybe that
Hmm.
doctor's opinions or his personal beliefs don't align with yours.
Right.
And that can affect your care. So if
Hmm.
that's the case, why would you continue to go to them?
Yeah,
You
that's
know,
true.
we all too often we go to a doctor and we just say, regardless of what their bedside manner is or their
Hmm.
personality is, we're just going to go to them because they're a doctor. But
Hmm.
all of those things factor into your care.
Hmm.
So you have to take a look at it and say, all right, is this doctor really the right one for me? Or maybe they're not the right one for me. We don't get married to doctors,
Right.
but we do in a way, because once we go
Mhm.
to them, we consider it this monogamous relationship that we keep forever. But we never
Right.
ever ask, is that the right person for us?
So
So
true.
part of what I'm advocating and saying is you have to look at that relationship with your doctor kind of like a marriage and say, is this the right doctor for me?
Mhm.
And
Mhm.
when you can do that, it changes the way that you view your relationship with your doctor. But it also takes a lot of pressure off your doctor if he's not the right one or she's not the right one to be able to say, I'm not the right one for your care.
Right. That is some good points because there was a time when we really didn't have to decide if people were the right doctors for us. It was just the industry was what it was. You really didn't have a lot of options. But now there are so many different factors that go into that. It's just like restaurants or anything else, right?
Yes.
You find one that works for you and keep it moving. So yeah, that definitely is a great point to bring up.
Yeah, so it's a very important one that I think
Mhm.
that we need to start thinking about when we see medical doctors. And then
Mhm.
if you're somebody who's got to have surgery, or you have major medical issues where they're talking about some significant procedures or changes in your life going forward, be open with yourself and ask the questions that you need to ask. Even if that means you go home and you write a list of questions
Mhm.
when you go in to see your doctor, have that list of questions and
Mhm.
ask them every single one of those points.
Mhm.
You know, um, I think we touched on this in our last interview. If you're somebody that's having surgery, whether or not you're aware of it, the AMA allows um, surgery closures to be less than the layers of the skin. So, for example, your stomach has 5 layers, but the
Mhm.
AMA allows your stomach to be closed in 2 layers. But if a patient was asked whether or not they wanted to be closed in 2 layers or 5 layers, all of a sudden you'd have patients saying, well, wait a second, I don't want to be closed in 2 layers.
Mhm.
I want to be closed in 5 layers.
Mhm.
And so when you start asking more questions about your procedure and how it's going to go, can ultimately make the biggest difference in your recovery.
Mhm.
And so I'll lay a little bit of an example as we go. I use the stomach example again with the 2 layers, the 2 layer
Mhm.
closure versus the 5 layer closure.
Mhm.
So if you do a 2 layer closure, you can have something called tethering, which is a really tight band where that surgical site is. And what happens when you have that tight band, you can have a bulge that happens over the top of it because that tethering is so tight,
Mm.
it pushes everything up,
Mhm.
so which creates a really hard line. It can also cause a lot of scar tissue. That scar tissue could adhere to major organs. And not to say that you couldn't have that with a 5 layer closure, but you certainly have less risks involved when you have a 5 layer closure. You're
Mhm.
not going to be as um, prone to tethering and that bulge that happens with it. And there are a couple other things too that can go with that. But the point that I want to make out of it is, don't be afraid to ask the questions about a surgery and your outcome, and get into the nitty gritty, because you know what, you're not mentally prepared for your surgery if you don't ask the questions and know what you're facing. Another way that that also helps you is when you go into that surgery, you can be a lot calmer about it because you
Mhm.
have an understanding of what's going to go on. And when you come out of it, it also makes it easier for you to manage both your pain and your
Mhm.
recovery, because you asked what was normal and not normal, and you trust your body a little bit more as you're going through it. And I think that that
Mhm.
would help a lot of people who are having surgery in their recoveries, because we don't always see the recovery that we want to see afterwards, because
Mhm.
people, they hit those pain points and they say, oh my gosh, I'm not going to do this because it hurts too bad. And there's a point
Right.
in allowing your body to heal, but then there's also a point where you have to go through that pain barrier in order to start recovery.
Mhm.
And we have a tendency to stop and not go through that pain barrier.
Mhm.
And I think part of that also comes in because we don't ask the right questions, both in terms of our surgery and afterwards. And that
Mhm.
that can also go not just with talking with your surgeon, but also talking with your physical therapist. The same things that apply and asking the questions for your doctor,
Mhm.
pre-surgery and post-surgery, also apply to talking with your physical therapist. Not all physical therapists are created the same, so you want to
Mhm.
really have somebody who's advocating for what your goals are,
Mhm.
because you certainly don't want to be doing it all alone.
Mhm.
So when you're advocating for yourself, there's a lot of parts in it, but it's really about you communicating the most and asking all of your providers in and around your care to communicate better with you.
I love that. And, let's just talk a little briefly about how networking played a part in you getting the proper care you needed through LinkedIn, right? So, talk to us about, the focus that you had to have and how you went about creating relationships to accomplish what you did accomplish in the end.
When I had my initial 4 surgeries and I was left in an unacceptable medical state, um, I had to really advocate for myself.
Mhm.
So, and, because I knew what I was facing was highly specialized, um, how was I going to reach all of these doctors that I need to? It's impossible to reach doctors, via phone and get that type of help. And I wanted to get a hold of people that could potentially review my file, that were willing to talk to me for a minute about what options I might have or avenues to explore that I wouldn't necessarily know to explore.
Mhm.
So what I did was I used LinkedIn, and I started connecting with doctors by just using the search bar. And I would put in a specialty, and I would look for doctors within that specialty. And I didn't just use doctors, I looked at holistic doctors, I looked at functional medicine doctors, I looked at chiropractors, sports medicine,
Mhm.
anything that had to do within the medical realm that touched in on my issues, that could offer some insight or something that I could go forward with that would help me advocate better for my own care.
Mhm.
And what I found when I reached out to these doctors was they were amazing. they
Mhm.
were they were open to talking, and a lot of
Mhm.
them were open to looking at a file, or
Mhm.
talking to you a little bit about your care, and giving you some steps that you go forward with.
Mhm.
So in my own particular case, it became critical, and it was
Mhm.
the most pivotal factor in my turning around my care and ability to get a complete reconstructive surgery. I would not have had that had I not utilized LinkedIn the way that I did, because it was not going to happen in my local community with my doctors, who, were too quickly and willing to write off,
Mhm.
that surgery, because it was going to be an incredibly lengthy and difficult surgery with a completely iffy outcome.
Mhm.
And so
That's amazing. Yeah, and so for somebody who it may not be healthcare, but walk them through some tips that you would give when it comes to how to network or how to hone in on what it is that you are interested in, who you're interested in contacting. So you mentioned like searching for that position, but for some people that's a foreign language. It's like, we're randomly making connections that LinkedIn suggests, but walk us through how we can, effectively do that type of networking.
sure. I think it applies more than just LinkedIn, though, too, because
Yeah.
if you have a particular condition, there are groups on Facebook. There are tons of
Mm,
groups all over Facebook. Get into
mhm,
those groups, ask a lot
mhm,
of questions. People answer you. There are tons of people out there that are dealing with the same issues as you, and some of them are farther along in their journey and they have great tips. Utilize
mhm,
those groups. So get into those
mhm,
groups, ask the
mhm,
questions on whatever your particular topic is.
mhm,
I'm sure at this point you've already done all of your homework by using Google or Bing or
mhm,
DuckDuckGo or whatever you're using to get your information. But use your internet browser and have all that information together. And the same applies when you go into LinkedIn and you're looking for a specialty. You're looking for something based around what your subject matter is. So whatever that condition is, you're going to look for people within that field.
mhm,
So you type in that search bar, whatever that phrase is, whether you're looking for, a neurosurgeon, or whether you're looking for an orthopedic surgeon, if you're looking for a nephrologist, or, a gynecologist, or whatever
mhm,
that is, there's a specialty for that. And you're
mhm,
going to look up that specialty, and it's going to give you tons of suggestions, and just
mhm.
start going into those profiles, and you can request a connection. You can even type a message. There's an option to type a message, and you can send a message to that doctor letting them
I
know
love
why
that.
you're asking for that invite.
Mhm.
And
I
it's all
love, and
about advocating.
yeah, so what are some things that we should say? Because, people probably get a lot of these invites, so what do we do to kind of make ourselves stand out to get that answer?
I really don't think they do get a lot of those invites.
Really?
and
Oh.
and maybe now, that we're putting it out there and we're telling people to do it, they'll get more. But I think as a whole they're not. But we're going to
Oh,
go back to that basic thing. You know what? They became a doctor for a reason. They became a doctor to help people.
I
So if
love
they're
that.
not willing to help people, why are they in that
Mhm,
profession?
mhm.
you know
I
um
love that.
and there's now, you're seeing um healthcare were set up where you pay a set fee per month, whether it's $25. Some of them are upwards of
Mm,
$100. You could pick up the phone and you can talk to a doctor, and
mhm,
you're seeing these happening all over the place. Utilize them
mhm,
for that minor
mhm,
fee. Some of them are free. Get on the
mhm,
phone, talk to these doctors. A lot of health insurance companies are now doing a hotline where you could talk to a nurse or a doctor. Pick
mhm,
their brains,
mhm,
go
mhm.
through it, and you can decipher out of that information what's really good and what's not really good. If you get somebody on the phone, they're not real open, you know what, don't stay on the phone with them. They're not your
Right.
person.
Mhm. Love that. This has just been great insight. I really think this is wonderful because, like I said, I'm one of those people, I try to do my research and, check in with different things. My daughter had to have a spinal fusion. Uh, I had to have a blood transfusion. One of my daughters did. So, you're kind of forced to those situations where you do have to do a little more research. But for many people, like I said, hey, we take the doctor's word as the creed, and we don't even think to question some of the things that could be their opinion versus fact. So, I mean, this has just been very insightful for many people that are watching, I'm sure.
I hope so. I hope so. And I
Mhm.
hope that this helps people manage their care better and make them feel like they have more control over that. I mean, mostly I can't tell people enough how much
Mhm.
control you could take over your own life when you start advocating for yourself in these simple steps. And they're really all simple steps. You
Mhm.
can do this. You can make a better outcome for yourself just by
Mhm.
doing these steps.
I
This
love
is the
that.
hope
And
that people are looking for.
so true. And so, what advice would you give somebody who a lot of times we don't advocate because we have that intimidation factor, whereas, we have this negative voice in our head. I don't know what they're going to tell me, or, they are medically sound in their field. And who am I to question that? So, what advice would you give somebody just to begin that conversation to help them feel more confident?
You know, that the first thing that I'm gonna say is that this is your life. It's your life. It's no one else's. No one else can live it for you. Don't
Mhm.
give them that power. Live your life. Speak your message. Do what's best for you, but don't cower or crumble down because somebody else doesn't see your life the way that you do. It's not their right.
Mhm.
Whatever that you want to do in your life, whatever is your passion, whatever is your goal to go back to, whatever your sense of normalcy is, that's
Mhm.
your normalcy. Hold on to that. Like that is the light of the sun. Don't give that
Mhm.
up.
Mhm. Great point. That is awesome. Well, that is a great point for us to close on. I want to thank you guys for watching today. And we have a message across the bottom of the screen. If you are interested in talking to Tab, reaching out to her to get some more insight, or you have some questions over your situation, feel free to reach out to her
Yeah.
through Facebook Messenger or LinkedIn. So again, we want to thank you guys for watching. And Tab, are there any final words you want to share with everybody?
Don't ever be afraid to speak up for yourself. Just keep
Awesome.
going at it.
Awesome. Well, thank you guys for watching, and we will see you guys next time. Bye for now.
Thank you.